This is the Surgeon General of the United States. In the American consciousness, this is what the nation's chief doctor looks like, a high-ranking naval officer wearing a classic double-breasted coat, gold braids, and the 4 stripes of a vice admiral. But despite the military appearance, this officer carries no weapons. They do not command a single ship, and they have no authority to issue military orders to the American people. Why does the top physician dress like a commander if they have no troops to lead? The uniform is an echo of a time when the nation's greatest enemies arrived silently at the water's edge, microscopic invaders that could decimate a city before a single symptom appeared. The history of this uniform explains how American public health gained its power, and how that power eventually undermined the very agency that wore it. In 1798, merchant ships were the lifeblood of the young republic's economy. But those same ships arrived in port carrying yellow fever, a terrifying disease that could empty entire coastal cities in weeks. Since sailors traveled between states, Congress made their health a national problem. They deducted 20 cents from every sailor's monthly wage. These funds built the Marine Hospital Service, waterfront wards designed to treat merchant sailors and quarantine arriving diseases. By the 1870s, John Maynard Woodworth centralized these scattered hospitals into a disciplined force. He put his doctors in crisp, Navy-style uniforms to ensure they could be rapidly deployed wherever a disease threatened to spread. This wasn't about military conquest. The uniform was a tool to organize a mobile medical response, signaling their primary weapon was science. At the turn of the century, the service functioned as the nation's gatekeeper. At Ellis and Angel Islands, millions of people were screened by uniformed officers before they were allowed to step onto American soil. The most visceral tool of this power was the button hook. In a line inspection lasting only seconds, officers used the metal hook to flip back an immigrant's eyelids, searching for signs of the contagious disease trachoma. While the button hook was a visible sign of physical authority, a much broader power was being established behind the scenes through the 1902 Biologics Control Act. This law gave a tiny one-room operation called the Hygienic Laboratory the authority to decide which vaccines were safe for the public. They became the nation's first biologic regulators. They didn't need to write the laws. Their power came from setting the scientific standards that every manufacturer was required to meet. This scientific authority wasn't just a bureaucratic mandate. It was forged through extreme physical danger on the front lines of research. In the early 1900s, public health service officers worked out of a converted schoolhouse in Montana's Bitterroot Valley, hunting the cause of Rocky Mountain spotted fever. To study the lethal rickettsia, researchers had to breed and grind up thousands of infected ticks under primitive, hazardous conditions. The cost of the work was high. Multiple lab workers contracted the fever they were studying and died, while successfully developing the first vaccine. Their authority was built on the data collected in those field quarters. It proved that the service's real strength was intellectual bravery, not martial force. In 1951, the onset of the Cold War introduced the fear of a biological attack. To ensure the country had experts who could spot a man-made outbreak before it spread, the government created the Epidemic Intelligence Service. These disease detectives eventually deployed to the Bolivian jungle in 1961, where a lethal bleeding fever was decimating villages in the Beni region. Using shoe leather epidemiology, the team mapped the infection house by house, eventually tracing the Machupo virus to a specific jungle mouse and ending the epidemic through systematic rodent trapping. The uniform signaled the authority to walk into the dirt, find the biological truth, and advise the world on a cure. The Public Health Service eventually faced a unique problem. Its scientific successes were so effective they outgrew the service that created them. That one-room hygienic laboratory ballooned into the National Institutes of Health, the largest funder of biomedical research in the world. The service's early field investigations and malaria programs birthed the CDC, while their vaccine regulation work became a foundation of the modern FDA. The parent agency effectively hollowed itself out, transferring its structural power, budgets, and prestige to these new, massive offspring. By 1968, a reorganization stripped the Surgeon General of direct authority over the agency's programs. By 1981, the service's original purpose, its hospitals, were entirely shut down. The Surgeon General's primary tool became a microphone. In 1964, Luther Terry used that voice to release a report declaring that cigarettes cause lung cancer, a statement that drove a massive, decades-long shift in American behavior. But without a budget or an agency to lead, the office is politically fragile. Dr. Joycelyn Elders, and many like her, found that a Surgeon General can be removed the moment their medical opinions become politically inconvenient. The U.S. Public Health Service won its greatest victories through quiet science and personal sacrifice. It is a legacy so successful that it made the very commanders in uniform almost invisible.